At your child's 6-month visit, we get to talk about the normal developmental milestones, but the best part is talking about food. Introducing solids comes up now, as well as something called separation anxiety. During your child's 6-month exam, we're going to be looking for certain physical milestones, like standing your child up and making sure they extend their legs.
A 6-month-old will be much more upright, able to sit if supported. Some kids will actually sit and support it as early as 6 months, but most 6-month-olds won't.
They'll also become much more interested in the world around them, much more interested in the noises and the sounds that are going on in their world.
At 6 months, we're going to talk about introducing solid food. Everything from how much, how often, what to introduce, and what not to feed your child.
So your goal in introducing solid food is to have 3 meals a day, breakfast, lunch, dinner. This is a time where either breast milk or formula becomes secondary.
There's no particular order to start solid foods. You just go for it. Everything goes except honey.
We want them to avoid going into the bland pickiness phase.
Everything you eat with the same spices, put it in a blender, give it to the baby with a teaspoon, and follow your baby's cues. Some babies will devour food from the first day, and some babies will take a little time.
One trick is don't give them a lot of liquids before they eat their solid foods, because that will fill up their stomachs and they won't have as much an appetite. You'll start to notice that your baby might be experiencing a little bit of separation anxiety or stranger anxiety.
Separation anxiety manifests in 2 ways. The first is when, let's say you're in a room and you will leave a room, the baby will start crying, looking for your presence. The second way is the baby will become a little bit fearful of people they don't know. This is a perfectly normal stage of development, but a stage of development that you should anticipate.
It's a natural transition where they start to recognize who's important to them and who's a stranger. So just be patient. The whole phase will pass as long as you don't feel too anxious about it yourself.